Struggling with weight loss and considering bariatric surgery? Meet Dr. Hanna, a board-certified bariatric surgeon who will guide you through the transformative options available. From gastric bypass to SADI-S, discover the right procedure for you.
Being here now doing bariatric surgery for the past 19 years, I've seen a lot. And we've done the standard procedures. Many years ago, that started out with the gastric bypass. And gastric bypass, it works, and it's still here today, working. What came after gastric bypass and all the other stapling procedures was gastric banding. And I myself have put hundreds and hundreds of bands in when it was FDA approved here in the US. It worked well for a certain period of time, but now we see that a lot of patients are coming back with their lap bands or gastric bands, wanting them out, not having great success. The success is low, they're having issues, the bands are slipping, they're having band erosions. So in the past 4 or 5 years, bands have been phased out. We don't do bands anymore. All we do is take them out. Also, along the past 10, 15 years, the gastric sleeve came around. Gastric sleeve is just removing a part of the stomach. That way we make the stomach smaller, and we can also decrease ghrelin, which is the hunger hormone. The two different procedures are either restrictive or malabsorptive. The malabsorptive procedures are where you're rerouting the intestine some way. Gastric sleeve is only restrictive, and that's the most common procedure we do now because it's easier and actually it has great success. And we're only operating on the stomach. So we're seeing now that revision surgery is now coming, it's now very popular and a lot more people want revisions. So sleeve to gastric bypass, that gastric bypass revisions, we look at that, but we look at individuals as an individual and we decide, is this appropriate? A lot of our patients that come to us for gastric band revisions, we're removing those bands and we convert them to gastric sleeve. Usually that's the initial step that we take because sleeve works really well. And we've seen that a lot of these patients post-gastric band removal are doing very well with gastric sleeve. There's also the more extreme procedures, the duodenal switch or the SADI, the single anastomosis duodenal switch. You're talking much more extreme procedures with much more possibilities of malnutrition or nutritional issues. So if you're not in a really good program that are following through with your diet, making sure you're taking your vitamins, then you're at risk for nutritional issues. So you have to be careful with the revisional surgeries to make sure that it's appropriate for that individual and also that they're gonna follow through and be healthy and be well.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.